With a nearly 50-year career that has spanned the world with unwavering commitment to the well-being of others and growing the Duke Global Health Institute into one of the leading global health centers in the country, Michael Merson is recognized as an international leader in global health.
I visited close to 130 countries in my life, and it's just been wonderful to watch the field grow and to be part of that.
Merson came to Duke in 2006 after 17 years at the World Health Organization, followed by a decade-long tenure at Yale as Dean of Public Health. While at Yale, he was lead editor of what remains today as the most popular textbook on global health. He recently co-authored a comprehensive history of the AIDS pandemic that was favorably reviewed in The Lancet. When he arrived here, the Duke Global Health Institute was little more than a concept.
Why I found it so appealing was that it would be an institute that would involve all the schools and that would approach health in a very broad perspective.
The vision was to build the institute on a foundation of education and research.
We need many disciplines and many professions to really be effective in dealing with the many global health challenges we have today.
He launched an undergraduate global health degree that is now the 7th largest major at Duke. He started a master's degree program and a global health residency program that is arguably the most successful in the nation. He introduced global health components to the schools of medicine and nursing, and he recruited nearly 70 new faculty in key areas like infectious diseases, environmental health, cancer, and more.
Our faculty and students are working in around 40 countries of the world. Tanzania, Uganda, Kenya, South Africa, Sri Lanka, China, Peru, Haiti.
Just to name a few.
I think what sets it apart more than anything else is that we are bringing the whole university together, and that allows us to come up with discovery and educate future leaders in a way that's quite unique.
Raised in Brooklyn, Merson was inspired to pursue medicine by his cardiologist grandfather.
I was always impressed with his compassion for his patients and what it meant to be able to be a healer.
Merson began having an impact in medicine immediately after earning his medical degree from SUNY Health Sciences Center in Brooklyn. While working at the Centers for Disease Control, he helped to discover the cause of travelers' diarrhea while attending a medical conference in Mexico City. Ironically, it was a conference of gastroenterologists.
Despite all what they knew, about 70% of them got sick within 3-4 days, and we found that the major cause was enterotoxigenic E. coli, which is still the major cause today.
While working at the World Health Organization, Merson was in the international spotlight as director of the WHO's global response to HIV/AIDS from 1990 to 1995, charged with mobilizing and coordinating global efforts to address the pandemic.
We had no treatment, so infection was seen as a death sentence. There was a lot of stigma, discrimination. It was a tough time.
He designed care programs to improve quality of life of those infected, created education and prevention outreach programs, and developed initiatives to encourage HIV testing. Before directing the AIDS program, Merson led the WHO's Diarrheal Disease Control Program and its Acute Respiratory Infections Control Program. Merson is married to Kathy Sikkema, a professor of psychology and neuroscience. She recently was named the first Gosnell Family Professor of Global Health at Duke. Their son Jonathan is a psychiatrist in New York City. The Mersons have 2 grandchildren.
Neither one is yet a physician.
Merson said that the success of the Duke Global Health Institute is truly a team effort.
I couldn't ask for more from the leadership of the university. All have wanted the institute to succeed, and that's the big reason why we've been successful.